Hmm.
I don't see her.
Oh, it just turned 12. Sue and I were early.
That we were.
Stops Maggie from worrying if I'm on when she gets on.
Hi, Maggie.
Hello, Sue. How are you?
I'm doing fine, thank you. Nice to see you.
Nice to see you too.
Sue has a son who works in childcare. Corey Paris must love that.
He does.
Where does he work, Sue?
He just started a new job. He's at, make sure I get this right, Beth, New Beginnings on Laurel Street in Hartford.
Right.
And my son is 6'6" and then some. And so he's in the preschool room and he's got the threes, fours, and older threes and fours and fives, and they just love their Mr. Daniel.
That's awesome. We need more men in childcare, there's no doubt. I don't see our attorney, Cynthia, and Kristen just said she's not on the invite, but she told me she was coming. So maybe Maggie, if someone could just forward her, because I don't have my other screen, I can't really forward it.
Ashley just put the link in the other meeting for her, so she should be here soon.
Thank you, Rachel.
Welcome.
Good morning.
Good morning,
Can you hear
Representative.
me? Good
Good
morning.
morning. Good morning.
Good to
Or
see
good
all of you.
afternoon.
Good afternoon.
Yes,
So,
we crossed over.
We crossed over.
let's see. I'm trying to see who's in.
So if you're
Okay.
looking for your co-chair, you won't find him. He's not in yet.
Oh, he's not in yet. Okay.
No,
Okay. Let me see. So
but
I
your
guess
ranking
because
members
we,
are.
okay, very good. Good to see. I can't see everyone, but good morning, good afternoon. And I know we have a whole lot to cover. So good to see you, Commissioner.
Good to see
Um,
you, Representative.
yes.
And
And
Commissioner, if you or your staff want or need to share the screen to share any documents, that's enabled. So feel free to do so.
Okay, great. Representative, do you want me to quickly introduce who's here, or do you want them to introduce as they speak? Whatever your preference is.
why don't you go ahead and introduce who's here?
Okay.
Thank
With
you.
me today is Deputy Commissioner Elena Trueworthy, Chief of Staff Catherine Devine, our Chief Legal Cynthia Watts Elder, our Head of Home Visiting Ashley McAuliffe, our Quality Enhancement sort of Director of Quality Initiatives Deb Fliss, Nicole Cosette, who runs our Birth to Three program, Julie Giacone, who runs CCDF, which is Care for Kids, Eloisa Melendez, who oversees our Blue Ribbon Panel efforts, Kim Palesko, who oversees our early childhood programming, Rachel Guthrie, who's working in home visiting and particularly universal nurse home visiting, because there are questions about that, Jill Marini, who's does a whole lot of things here, but for these purposes, she's been overseeing the study and TriShare, and she's sort of our Eastern Connecticut focused person working to expand access there. Michelle Cook, who's working on our legislative and policy efforts this session. And Sarah Poulin, our fiscal director. Representative Belinsky, you don't work for us. I'm skipping over you. Good to see you, though. Kathleen Hindman, who oversees our workforce efforts. And I think, did I miss anyone? Luz Rivera, who is our sparkler expert. So we tried to bring the people to answer the questions that you had asked.
Thank you so much. I guess I should have had them to do it. I didn't realize it's such a big undertaking. So thank you so
No,
much.
that was much faster.
Okay. So, and we do have a lot of questions. So we'll just jump in and go through the questions, and members can certainly, if you have questions, just let me know. So we'll start. I'll turn it over to you, Commissioner. Do you want to guide through?
Sure.
Number one was provide plan and do it that way.
Sure.
Okay.
The first question was, how how will we, it was about the plan and backup data for the UPK
I'm sorry.
endowment.
I'm sorry, before we start, do you guys actually have the document you can put up that had the questions and the answers?
Sure,
That's
I'll ask
cool.
Kristen to share her screen and do that.
Perfect. Thank you.
And the, so I'll start with, first of all, the pre-K endowment plan is a very big spreadsheet. I have it here with the plan to go over. We attached a spreadsheet that goes through supply and demand information, rate increases and infrastructure. I'm happy to answer any specific questions for you. The very specific question was how infant toddler care would be addressed. I thought I'd start there if that's okay,
That
representatives.
would be good. Thank you.
Okay. So infant toddler care is the biggest shortage area in childcare in Connecticut. So this is a really good question. And we did consider infant toddler care in the universal preschool endowment through rates. So to make sure the plan is to bring preschool rates to the level that teachers can be paid the same as kindergarten teachers. So like, for example, the school year rate goes from $6,000 a child to almost to $9,900 a child, over $9,000 a child by 2028 when the program begins. And the infant toddler rates go up in the same way. So there's about $79 million there. Also, it's important to note that the governor has focused on infants and toddlers up until this plan, adding 1,500 state-funded infant toddler spaces. Also, there are way more infants and toddlers in the Care for Kids program than there were prior. You know, we've gone from serving about 16,000 to 23,000 children in Care for Kids, a good number of those with infants and toddlers. Oh, I'm so sorry, I misspoke. The $79 million, let me just go back up. I'm sorry, going too fast. So when this goes into effect in 2028, programs will no longer be able to double bill for Care for Kids plus state-funded tuition.
Okay.
And so that frees up $79 million for Care for Kids, much of which will go to infants and toddlers. We've also budgeted for infant and toddler rate increases, and that amounts to about $50 million a year in rate increases for infants and toddlers. And if you go to question 3, you're going to see that under Governor Lamont's leadership, infant toddler care, the access, sort of the number of infant toddler spaces has gone up significantly as we are subsidizing more infants and toddlers. The license capacity for infants and toddlers has gone up so that it's not as simple as making spaces. It's if you pay at a rate that programs can operate with, then you get more supply for infants and toddlers. So we think Governor Lamont, you can see, I think it's a significant increase, particularly since 2021, beginning with the stabilization grants. Then we also had, in 2022, we increased the rates from 9,000 to 13,500 for infants and toddlers. And then in 2023, we increased the rates for Care for Kids significantly. So you can see as the rates come up, so does supply. So I'll stop there with that question and see if there are any follow-ups.
Are there, let me see.
Yeah. I have a question.
You have a question?
Sure.
Go ahead, Tammy.
Yeah, I have a couple. You mentioned bringing preschool rates up to the same rates as as kindergarten teachers. Do they have the same qualifications? Are they the same, like, you know, degrees and
The
everything?
requirements will go up with the pay, exactly. You'll only be paid at the rate of kindergarten teachers if you have your bachelor's in early childhood. If you have an associate's, it would be at a different level, sort of based on OEC's narrow cost analysis of wages. So if you apply to be in this program, you have to agree to sort of live within the salary ranges, which the top tier would be equivalent of kindergarten teachers, but for teachers with those qualifications.
So is this just then preschools that are in schools? Are we doing this? Because I'm thinking like your regular daycare, right? Or your town preschool program. How is this affecting them?
So this is, any program can apply to be part of this system. There'll be an RFP in 2027. So it will really depend on the community's plan. So your community would have a plan and maybe they say, we need a third of the spaces to be full day, full year because of our working
Right,
families.
a third of what spaces though, Beth? That's what I'm
So-
trying to get at. Like,
Yep.
where are these people located?
Well, as the fund grows, it will be every town. It will start in the highest need communities and highest desert towns. And the funding will follow that. And as the fund grows, we reach more and more families in the state. So communities will send us their community plan. Programs in that community will apply for funding, and it might be public schools and it might be private programs. And then they will be funded if they, sort of win the RFP.
So they'll be funded at you said $9,900 rate per
Yeah.
year per student.
Yes.
Okay, so what does this mean then? A, for towns who don't qualify as the highest need, because I'm going to be honest, it's never, ever, ever the Northeast or Northwest corners that are prioritized anywhere. And secondly, if you have people who don't qualify for this free payment, right? And the providers decide that, it costs more than $9,900. Like if you look at Care for Kids, that means people who don't qualify for the program have to pay the difference and pay their portion, right? That's how the business model tends to work. So how does this work for the people outside the $100,000 income level?
We actually, first of all, Northwest, for example, is a childcare desert, as is Eastern Connecticut. So in the past, it's only been on need. Our strategy is a combination of need and desert. And the idea is this is bringing more money in the system, period. So we believe it helps the whole system. If a private provider is in this system for preschool, it will reimburse them at a higher rate. And if they're not, then they will charge, they can charge what they charge. We know, just like there are private schools, there will continue to be private childcare programs that aren't a part of this. But we believe as it grows and the fund grows, that it will reach statewide and we will get to full, that any family that makes $150,000 a year or less will have a subsidized space.
Well, the 100 to 150 is a small subsidized piece. So I'm concerned that, this is going, what does this mean to the people who don't qualify for that? Because we've already seen countless state programs for the people who don't qualify, whether it's Medicaid or everything else. Those are the people who are picking up the rest of the cost. So I'd like to understand the plan a little bit better in relation to, the spots that you have here, 1,500 spots or the 1,300 preschool spots. This is a really small impact, and depending on where those are going to go, I'd like to see what it's going to do to the regular market also, and inflating those prices.
Okay, and we're happy to sit with you and talk about that. These are added spaces, so you've got to know that already between the public schools and OEC, we have a supply of 45,000 spaces for preschool, as of right now. So you have to think of this as each of these is additive.
No, I understand that. And I just know that right now the cost of preschool and daycare is outlandish to a lot of families. It doesn't make sense for some people to even be two people
Right,
working.
and that's what we're trying to address.
Well, but a lot of those people, double income, are going to exceed that $100,000 very easily. So
Well, and I think that would be up to the legislature to have a conversation with the governor if they believe that top number or the subsidized number is too low. We've definitely had feedback since we've rolled out this plan that the families, for example, between 150 and 175 would be adversely impacted, or families with, that have more children. So we're certainly open to conversations around that and the impact of those changes on the number served.
May I ask a question too around when you mentioned the areas that would be the deserts? So what would be the first areas that would be addressed with this plan?
So what we do is we put high need and desert together in like a formula that we've been working on with UConn. So first to be addressed would be high need and high desert score, both. You know, if you are both a high need community and high desert, I'll give you an example. Norwich is an example. Believe it or not, Bridgeport is an example. Because there's such a big population, they don't have near the supply they need, and they're high need. So we could get this committee sort of some data that sort of shows what a combined score looks like when you go desert and high need.
Okay, very good. Let's do that so we can move on. I know we have a lot of questions and we have designated until 1 p.m. So let's move forward. We've kind of addressed 2 and we looked at 3.
Yeah, 2, yep. 2 just shows the expansion. And the only thing I'd add to that is what you all have to understand is between 2019 and 2025, Governor Lamont has added 9,400 spaces between care for kids, school readiness, and child daycare. We've added 9,400 spaces. So you see that they continue to add up, but I don't think you can lose sight of the fact that he's already been making these investments, as have you. You know, these were approved by the legislature. So we've made great progress, and this is very specific progress toward particularly infants and preschoolers from 26 to 32. So that's 3 and 4-year-olds. Okay, but go ahead. Number 3. I don't know if you want me to go over this. I talked about capacity, and this just shows how we're meeting, working to meet the demand with the supply and demand. I just want to be clear that every cohort of children is about 36,000. And when we worked on this estimate of demand, we're, just growing the system in line with how it actually grew in New York City and DC, where you go from, maybe 50% participation to over 10 years, you get to 75 to 80% participation. So we've built the program based on actual numbers in New York City and DC. But just know that the estimated need takes into account not 100% demand, but expected demand, because not every parent of a 3-year-old wants them in school right away. And some parents are always going to choose country day school and not want to be a part of the system. But so I just want to be clear about how we got those demand estimates. And if you want, we could put up, I think for Representative Nuccio and maybe for you, Representative Exum, very quickly, I could ask Kristen just put up our supply so you can see our current supply. Would that be helpful?
Yes, I think, would that be helpful? Yes, please. See that?
Just so you can see, we have a non-system, sort of, you can see how complicated it is now for families and how many different options. Can you read that? Is that big enough for you to
I can see
read?
that.
So you have half day, school day, full day. And then this year we're expanding to get to the current supply. And the source of funding is down the right side.
Can't see that part.
Okay.
Please ask a question about the demand
Sure.
and
Yes.
unmet demand. When we look at these numbers, we're talking about families who have, I imagine it's very hard to collect this data, but families who have an infant through a pre-K that want to send their child to these programs and can't because they're not available, they're in a desert, or want to send their child but can't afford it.
Mhm.
And it excludes everyone else, although it's probably very hard to figure out the everyone else, because someone who may not be able to afford it may just be stretching and sending their kid or doing whatever. But that's all we're trying, that's all these numbers capture?
Yes,
Is stated request for a slot that's not met by a desert, or stated request that's not met by lack of money on a family?
there are estimates of how many parents aren't reached by the subsidized system. So they may qualify, but there aren't enough spaces in the subsidized system. So we look
Okay.
at how many parents making under $150,000 aren't in this number and still need care.
Okay.
But Representative, your point is so well taken, and our non-system, because we've never adapted to the two-parent working family in many ways, means we don't exactly know what parents want or will choose. Now, part of this plan is to create a parent portal where parents will go to a common site and say, I need full day, full year care. I live in this town. I make this much money. We'll have such better data about where we need the care once we create a system. The non-system parents find out about preschool like at gymnastics or at the school bus for their 6-year-old. There, and I often meet families who didn't even know there was such a thing as state-funded infant toddler care, and they would have qualified. Like you're saying, they're stretching. But if we have a system that shows parents their options and their options where they can get help, whether it's care for kids or a state-funded space, we think it's going to make a big difference. And you can see all the programs aren't even full. Well, parents don't even know where all the empty spaces are. We have like 300 programs advertising for parents, instead of parents going to a portal and saying, I live in West Hartford. Okay, there's Head Start, there's public school programs, there's private programs, there's 5 school readiness programs, there's 2 infant toddler subsidized programs. So it's some kind of logical place to go to find out what your options are. So I think that's an important part of this puzzle, that parents just don't know what's available and what's subsidized and what they can and can't afford. And they might not even know about Care for Kids and that they'd qualify.
But the universe is still limited to exclude still the constituent that I met last summer who was a stay-at-home dad and had chosen not to work because the cost was so exorbitant for their 2 kids. But I'm sure, but the wife's income does not qualify for would not qualify for any of these programs. So those people, I understand why too. It's not critical. Those people aren't captured by this because it's so hard to quantify them.
Well, I would not say they're not captured by it. I would agree that they're not captured by the subsidized system, but that said, like in my community, 40% of the school readiness spaces are reserved in the public schools for other parents. The public school preschool for children with special education is free in most communities, and they're looking for peer sponsors, but parents don't know they're free or reduced cost options in their town. Most public school preschools are free, or like $4,000 is what we found talking to superintendents is the cap. And many of them don't have income thresholds. So there really are some subsidized options for all families, but we don't do a good job about letting them know. Like in my community, because of Chef, every parent of a 3-year-old applies to the magnet lottery to try to get a free preschool space. And that's true in New Haven too. So it doesn't totally leave them out, because a system that tells them what their options are would still help those families.
Thank you.
Mhm.
I'm sorry, so are these numbers for just people that make under the 150,000, or is this the total universe?
These numbers here are the current slots. The public school half day and part day, 40% of school readiness. So not all these families are low income, but these are programs designed to serve predominantly families who are low income. But public school part day and public school school day are not necessarily, and depends on the public school and how they, distribute their preschool spaces.
So this is not the whole universe of kids who need.
This is the whole universe of slots that are available and subsidized. The whole universe of kids is 36,000 per cohort. So 3, 4, and some 5-year-olds is
So this would indicate though that there's a slot for every kid. with 38,000, right?
No, because we're talking about a system that serves 3, 4, and a third of 5-year-olds. So you get to 30,
So-
72,
so,
80,
yeah.
84,000. So this is, this is showing about half, spaces for about half of the total. But again, experience in other communities is that not all parents enroll, particularly parents of 3-year-olds don't tend to enroll. You'd be surprised how many families don't participate, and it takes time to get there.
Okay.
Okay.
I'm sorry, is there I confess I haven't been able to get through all of the great materials that were sent in advance of this meeting. Is there a list of what districts have non-income based free preschool or care at these ages? Because until this portal is up, I know this one constituent of mine has no idea.
Yeah, we can work with SDE to see that. SDE does have a list of, there are public school preschools in every community, and in every community, there's a need for peer models. But some public schools have a lot more preschools, like Old Lyme, for example, has universal preschool for 4-year-olds. But we can ask SDE if they keep that information, and we can look in our records as well.
Thank you.
Just curious, is something, if a parent called 211 and asked for a referral or reference, would they be linked to some place where they could find out more information?
Well, they would get a listing of all the preschool programs available that are licensed through OEC, which is different than the public school setting. I'll ask Julie to weigh in if that's wrong. But there's no place, the problem is we're crossing two worlds, like half of these seats are in public schools and half are subsidized by OEC. Of these subsidized spaces, you can see this work getting ready for this bill really helped us see it's like 50-50. But Julie, does 211 keep the public schools?
Yes, they include that.
They do, okay.
Yes.
So they do.
Okay. Okay. Just good to know.
Yep.
I remember back in the day that was a resource, but I didn't know if it was.
It's still a resource. It's a nice resource. We just feel like a common place for parents to go will both, if you go to Washington DC's site, just pretend you have a preschooler in Washington DC, you'll sort of see what it can look like. And it both guides the parents quite readily, and it gives the city information about where they need to site more preschool and what kind.
Okay. Very good. Thank you. I see Rep. Johnson has a question.
Thank you so much, Madam Chair. And I just wondered, you're still in this is there anything that we're doing on a statewide level that creates these barriers for coordination? That's my first question.
Well, I would say we have pretty good coordination with SDE, but it does cross both worlds. I'm just going to ask Kristen to put the questions back up now. But we do think it's 2025, and there are some technology solutions that they're using in Colorado and New Mexico that are proving very useful for families and really useful for state planning.
Oh, thank you so much. I didn't mean to have you repeat.
No, that's good.
It was in the Human Services Committee meeting too. And then the other question that I have, and it's something that always really affects me all the time in terms of thinking about how we address women and children who are on the temporary assistance for needy families, and how many of them need to have access to childcare so they can work because they have a work requirement. And without the work requirement, then they don't have any resources after 30, I think we've got it to 34, 36 months now that they can have a chance to figure out how to move forward. And not having access to childcare when you have a work requirement, and then you're going to be in a homeless shelter. I mean, as you know, I've said numerous times, my district, we have 3 homeless shelters, 1 domestic violence shelter, 1 no free shelter that's getting another building, and then I have the Holy Family Shelter. My discussions with the people who run the Holy Family Shelter actually are discussing how they go to work and then they can stay in the Holy Family Shelter and have some help there, or have some part-time care someplace in the area that they work with the Holy Family Shelter. But it's not a consistent way of operating. So are you involved at all in the coordination of TANF with
Yeah.
early childhood access care?
Yeah, I'll have Julie back me up, but I believe that TANF has priority enrollment in Care for Kids, so they don't have to go on the waiting list. They get in right away. Julie, isn't that, I just want to confirm with you.
That is correct. And we also have the protective services. So if you are homeless and you submit an application, you do not go on the waiting list. You are considered protective service and there's no family fee.
And those are things the legislature, the protective service just happened a couple of years ago where the legislature said, if you're homeless, you should go to the front of the line so you can work and your child can have childcare or get, help you find a job and have childcare.
Now, what about when TANF runs out?
I'm looking to Julia.
So when when the family comes off TANF,
When they're required by time frame, they're off.
okay, and so Kristen, who's really very well with the regs, is it 1 year after coming off TANF that they're still considered within that priority?
I don't want to misspeak, and I can double check and I can add it in the chat, but they do have a time frame that they transition off
Right.
of TANF and are still considered priority. And the hope after that time frame is that they are gainfully employed, and then would qualify without having to go onto the wait list again, in our priority group 4, which serves families that make under 60% of the state median income.
And do we
I can
have,
find out that time frame.
that'd be great.
If I could please ask Rep. Johnson, if you and perhaps Kristen could connect, or Kristen, if you could give us resources in the chat, only because we have about a half hour and we have a lot of questions ahead of
Absolutely.
us.
Now, that was the end of my
Okay.
request for information, and I thank you so much.
Thank you so much. So we'd like,
Some from the information, I can send it to the subcommittee. We don't utilize the chat for these meetings.
okay,
Okay?
thank you.
Great,
Thank
you.
Thank you, Madam Administrator. So absolutely, thank you so much. And that way we could all see it too. Commissioner, going back to the Sparkler app, moving into that
Yeah.
question. Thank you.
Yeah, I'll give an overview and then I'm happy to answer questions. I think what's important to understand about Sparkler is this is a tool that is used to support the efforts of OEC, DCF, DSS, SDE. This is a tool that we put in the hands of parents to help them do their own developmental screening of their child, get connected to services as needed if their child registers as needing supports, and also provide, activities to support their child's development in areas where they may need support. This is something we started during COVID. We were paying a per child rate, and then we just said, let's just make it free to all families in Connecticut. And I will just say, like, as an example, my granddaughter's language delayed. Her father found out by doing Sparkler, the score landed at Help Me Grow. Help Me Grow called them, Birth to 3 came out, did an assessment, and now she's getting services. I think the value of this, and that's in a family that's pretty connected to what's happening in early childhood. The value of this is that you get to children early if they have developmental delays, and you help parents sort of understand what's there with development. And I'm sure as this subcommittee hears about all the special education and social emotional needs by younger and younger children, this helps us find those children earlier and provide help me grow support, meaning the parents can talk to child development experts on the phone if the child is in need of support. So this has been, I would say, one of the great finds of COVID, making this just available to every parent. And we have tens of thousands of parents using it every year, and it's growing every year. It's really been a national model. And I think the budget amount under $2 million, or maybe it's just $2 million, for all that child find activity and supporting increased access to birth to three for families with needs, we think is super important.
Thank you so much. Are there any questions on this one? Yeah, that sounds like just such a wonderful tool. Moving on to, okay, rate increases.
I'm happy to answer any questions on the rate increases. I don't think I need to go over them, but if there are particular questions from committee members about rate increases, I'm happy to answer them.
I think we can move on.
Okay.
Thank you.
Universal Nurse Home Visiting, I would say as commissioner, this is a program that I feel like is a game changer for the long term for the state if we can continue this effort to get to families right after the birth and get to every family. This is a kind of thing that we're saying it's not income bound. Every baby born at a Bridgeport hospital right now is getting a visit from a nurse saying, do you want to participate? And same with we're launching in Norwich, launched in Norwich as well to start in these two communities, an urban and a rural hospital. And the $1.8 million is needed to get us through, the current funding ends 12/31/2026. This gets us through to keep the program going. And we have a contract with University of Massachusetts is doing a sustainability study to see how we can leverage existing state funds and federal funds to expand this. And also, we also have a contract with the PN to 3 study that's studying things like emergency room revisits, all the kind of cost savings that the Universal Nurse Home Visiting has. And if you'd like, I know I have staff on board who can speak about the findings in other states with Family Connects, which is the model we're using, but I'll leave that up to your discretion, Madam Chair, of this committee.
I'd like to see if anyone has questions on the Universal Nurse Home Visiting Program. Yeah.
I just have a quick one. This is going to only these two communities, but anybody who has a baby, we're offering them 1 to 3 home visits.
Yeah.
And are we billing their insurance for this? Or are we just?
Not at this point, but that's involved in the UMass study and looking at how it's going in New Jersey and other states that are doing that.
So do we have a plan to bill people's insurance for this or just?
The plan is to look at all sources of fundings to be able to go statewide, but we believe a lot of this kinds of services are billable under things like Medicaid, private insurance, and we also have federal and state funds that we apply to home visiting now. So that's what we'll be able to come to with when we get the study from the PN to 3 Center at Vanderbilt that's doing this. What are the outcomes? And then UMass, how can you sustain this and expand it statewide?
Okay, and this funding brings you through to 12/31/2026.
No, it brings us through till June 30th, 2027.
Oh, okay. So this 1.8 million brings us to the end of the fiscal year of 2027.
Yes.
Okay, thank you.
Thank you. Rep. Leeper? Morning.
I was just gonna, thanks, Madam Chair. Commissioner, I am so thrilled about this program and it really has impacted like the entire region to have Bridgeport Hospital offering this for anybody who gives birth at Bridgeport Hospital. I also think it's awesome that it doesn't have an income barrier, if you will, or limit, so that every new mom and baby can take advantage of it. But I was wondering, it doesn't look like currently there's been any Medicaid dollars going to this, but I was just wondering what the impact, if you guys are factoring in the potential impact of any Medicaid cuts from the federal government.
Well, that's the point of having a sort of an outside university do a study and make recommendations for sustainability. And I'm sure they're well aware of the federal, they specialize in this, of federal changes to Medicaid.
And I really look forward to seeing the cost savings that having a home visitation hopefully will realize. So when did you say that the results of that study would be back?
I'd have to ask Ashley and Rachel. They know where we are, when the sustainability and the outcome studies.
So things are just getting started, so it's going to take us about a year to get those results. So right around early next year, late this year, we're hoping to have some preliminary information that we can start building off of.
That's awesome. And I'm assuming, of course, there's going to be physical health components both for the mother and the child, but also postpartum is a part of that study. That's awesome.
Yeah.
And then last question, and I apologize because I probably should know this, but did the governor include this funding in his proposed budget?
Yes.
Love to hear it. Thank you very much. Thanks, Madam Chair.
You're welcome. Thank you. Rep Corpus?
Thank you. I think the question was just asked and answered, but the bottom line is that we don't know yet whether this postpartum program has resulted in fewer costs because of decreased ER visits, right? We don't know that yet. That's part of what the
We don't
study
know
will
that yet.
determine.
We know from other states who've used the same program what it is, but we really want to have Connecticut results.
Okay, and how many families are served by this program?
I'll
Right
ask
now?
Ashley or Rachel.
I might turn to Rachel for this one, but currently, we are sitting right around 1,000 families that have been served, and those are just the ones that have actually had the visit. I'd have to get you the number of families that have delivered and either declined or did not end up participating in the visit for the total number.
And for those families, is this the only form of postpartum care that they generally have? Ostensibly, these mothers, believe me, I understand the need for postpartum support, having done this 4 times, but is this these mother and family's only source of postpartum health care in general?
No, I don't believe so. I mean, they have an obstetrician follow-up, they'll have a pediatrician. This is just a home visit a visit in the home and potentially in the hospital to connect them to services. I should also say Connecticut model is a little different than other states is in that we also have community health workers, so that for families that need more extensive support, there are community-based folks who have a community health worker certificate who are connecting them to other resources like FQHCs and other things in their community, other kind of support services.
And I'll just add that the first visit where the nurse is going out to the home, they are doing checkups on baby and mom, doing screenings for postpartum and all of that. So there are a lot of questions that are being fielded and triaged at those appointments that might be clogging up the regular doctor's office or even going back to the ER that they might not have to do because they have that nurse right there in the home that's able to explain everything to them.
Thank you.
And just
Rep
to add to the
Johnson?
question.
Oh, I'm sorry.
No, it's okay. There is some data, that we provided in the attached documents. So you'll see a Family Bridge overview, and there are some, there is some data within that document at the bottom in terms of, contacts, family served, and touch points such as that.
Thank you so much. Rep Johnson?
Thank you so much. And this program is great. I think that I'm looking at having it come out to Eastern Connecticut. And part of what we have is a very large, in my district, very large minority community. And they've gotten rid of the maternity delivery services at Wyndham Hospital. And so having this follow-up and before and after birth is really something that's going to be, I think, life-saving. When you take a look at the death rate of the minority population when they give birth or the injuries that they suffer, this is the kind of thing, this follow-up care is the kind of care that will really be life-saving, and it will actually save funds as well, because there'll be the injuries and difficulties postpartum will be discovered by the nurse that visits. So this bridge program is, I think, fundamental to how we're moving forward. So thank you for that.
You're welcome. And just to note, the Norwich, while they are just getting started, they are focusing on that community and they've already established relationships. And the community health worker, I believe, is going to be up in Wyndham at the Women's Center like right in there in the clinic to be able to talk with people about this program right from that community.
So grateful. Thank you.
Thank you so much. Moving on to the Tri-Share, please, program. Update on that.
Just, I'll give you a high overview and answer questions. This is a new approach in Eastern Connecticut to try to encourage more providers and businesses to expand childcare access. And we're at a level now where we now have contracts with Learn and partnerships with CBIA to both recruit businesses to participate and also to get the funding out to pay for the childcare for the children. The idea is the parent pays a third, the business pays a third, and the state pays a third. So we have the funding in a pot to help cover the costs of childcare. And so it's currently limited to New London County, and it's just sort of getting off the ground now. I think we have one business enrolled that's going to start in March, and then others being recruited. Electric Boat plans to start not till next January, to align with some other HR things they have going on.
Are there any questions? Thank you for that. Okay, moving on to the CCDC program, number 8.
So this is a program that the state has been subsidizing for decades to try to support childcare for people that work at the Capitol and other government buildings around. I'm sure there are many on this call who have colleagues and friends or themselves have used this. They definitely had fallen on some hard times. They were down to 35 to 40 kids. They have a new director. They're up and running. They're up to 75 children. This has been a high quality early childhood setting, one of the first accredited in the state. And now the budget proposes to move the funding over to OEC versus it's generally been with the Connecticut General Assembly. So it's saying we want to get this out of our area and send it over to the executive branch to subsidize this program.
Senator McCrory, good afternoon.
Hi, Senator.
Hi there. Hi there, Beth. How you doing?
Okay.
Doing better?
Yeah,
All
day by
right.
day.
I'm good to see you. Good to see you. I'm sorry I was late. I was in the car. I came on a little late.
That's okay.
I heard you mention something about, I got 2 questions. I hope you probably touched on one of them earlier, but you're talking about CCDC.
CCDC, yeah.
What's going on at CCDC? I utilize that place. It's a great program. What's going on over there?
Is the governor's budget proposes that we continue to subsidize them to serve that neighborhood.
Oh, okay. That's a good thing. I'm sorry, Tammy. Again, I was late. I multiple things going on. Did you guys talk about the $300 million in the early childhood?
Yeah.
You guys talked about that?
We did that at the beginning, but
Yeah.
I mean, just talking about the plan, but we're happy to answer a question if you have a question about the plan.
I'll wait because I came late. I'll wait to the end and ask my
Okay.
question. Okay.
Okay.
Thank you.
Okay. Thank you. We're going to move, Senator McCrory, on number 9, we're trying to kind of go through, and now this is about Care for Kids slots. I know that's, why don't you just bring us up to speed,
Sure.
Beth?
This just really shows you that since Governor Lamont has been in office, there's been a big expansion of Care for Kids, and not just an expansion of people. We've expanded the rate at which families get in. It was 50%, now it's 60% of SMI, so more families have access. We've also moved the graduated phase out from 65%. I'm trying, what do we move it to? I wanted to say
85.
85%. So once a family's in Care for Kids, they can get raises and promotions and not, rarely does a raise or promotion rise to the level of covering your childcare costs if you get bumped out of Care for Kids. So we've reduced that benefit cliff quite significantly. We've also we've brought DCF into Care for Kids, which really, it was a real problem, DCF paying for childcare, because they were paying each like an outside contractor. Thanks to the good work of my team, now those families from DCF are on Care for Kids, so they're just part of the childcare system, making that more accessible. And so we've been able to increase rates, expand access in significant ways. We do have a wait list right now of about 1,000 families, not children, 1,000 families on the waiting list.
Were there any questions on that? Okay. Thank you for that. So next, we're looking at detailed breakdown of the costs associated with the two studies under the Start Early initiative. So
Yeah.
can you bring us up to
I'm going to
speed?
give you high level. You have the document in front of you. We were tasked, and Senator Funfar wanted to, in his goal was to say, how do we know these programs are making a difference? How can we make sure infant toddler care has long-term positive impacts, and what are ways we can check this out? And so we have contracts with the TMW Center, which is, you've probably heard about the 30 million word gap and some of the work that was going on in Hartford around increasing children's language development in the earliest years. So the TMW Center is piloting a new tool that sort of supports teacher professional development to try to enhance language development in our youngest learners. So they are in our state-funded centers. Right now, they've been piloting the tools, and then we'll do a randomized control trial and follow the kids through kindergarten to see how this intervention made a difference. And then we're partnering with UConn. The UConn Early Childhood Department is basically seeing if you fund infant toddlers, which we're doing with state funding, and layer on home visiting, are there different outcomes in childcare on its own? So they have randomly assigned centers where the family gets home visiting plus infant toddler care, and are comparing them to centers where they have state-funded infant toddler spaces, but no home visiting. And again, following those kids through kindergarten, seeing what the impact is on their development. And I think that why it was designed for 5 years was because 4 years was not enough to get the kids to kindergarten. It's infant toddler. And so we've provided the budgets, which are, while it's research, it's also literally services. Families are getting home visiting, teachers are getting professional development, programs are getting these tools to use to develop language development. And we have the 2 budgets that we've provided, but happy to answer questions on that. That was high level.
Well, I just have to say, I think it's going to be a fascinating study. I'm really interested in seeing what the outcomes of that will be. And as someone who was early childhood ed, and I started my first career and as an elementary school teacher, this sounds like something I'd really be interested in seeing the outcome and the results.
Yeah, and I know your time is short, but I know we could arrange probably a 45-minute meeting where the researchers from UChicago and the researchers from UConn could come give you a 20-minute overview of where they are and what they're doing. I will say it took longer to get off the ground than we thought, but everything does when these, when you're doing contracts like this.
Yeah. It'll be very interesting. I think that's something we should follow up on for sure.
Okay, so just let us know and we can arrange that as a Zoom meeting for 40 minutes.
Thank you. Were there any questions around that? Okay, let's see if we can go on to the gap payments. An explanation of how the reduction in funding for gap payments will affect providers.
I think it's important to know there are currently $13 million set aside for gap payments, in the governor's budget calls to cut 1 million of that 13 million, while at the same time moving to a new method of paying for birth to 3 services, which you can see on the 3rd page, shows the rates go up between 6% and 40%. So the idea was, if the rates are going up significantly, we can roll back a little bit of the gap payments. But you'll see that, 12 of the $13 million for gap payments is still in the budget, but happy to answer questions.
This is one area where I know we've received quite a bit of input, of a lot of concern around cutting that and around the tiered structure. So I would be interested in just understanding better the logic of the tiered structure, but this has received quite a bit of scrutiny in the
Yep.
hearings.
We're happy to. I'll ask Nicole from Birth to Three, because she spent a long time studying this and working on this tiered structure, working to try to enhance and really pay the professionals by degree, sort of by their skill set. But do you want to just talk briefly about that, Nicole, and the move to this tiered structure and what you think it accomplishes that benefits children?
Absolutely. Thank you, Commissioner Bai. So currently we have a tiered structure in place, which includes 2 tiers, a professional and then a paraprofessional. What the rate study cost analysis proposed was that we move in order to adopt the high quality services to families, evidence-based practices, promote the retention of staff who have gone through trainings and being able to provide the providers the ability to pay staff more as they engulf themselves in a lot of the pedagogy of early intervention. The rate study added layers to that professional rate and paraprofessional. So shifting from that 2 tiers to a 5-tiered approach to really being able to, as you go through the continuum in early intervention, which includes training such as being certified to provide service coordination to families. That is something that is outlined in the regulations and something that Connecticut really needs to institute. So as you go through some of those trainings, such as service coordination, you would move up in a tier in terms of that billing process, which would allow them to be compensated for the additional work that they would be taking on. In addition, those high quality services, when we have professionals graduate from undergrad and graduate degree levels, they're great. However, what does it mean to be a PT, OT, SLP teacher in early intervention? PT being physical therapist, OT occupational therapist, and SLP speech and language pathologist. So what does that look like in terms of our evidence-based practices? So this is really addressing, and is also consistent with other items within the agency. Commissioner Bai, feel free to correct me if I misspeak, but I think it aligns with some of the ECE work in compensating staff as they grow in the field and really being able to bill at that higher rate.
Okay.
Thank you, Nicole.
Okay. Thank you for that explanation. I'm sure that will continue to be an area.
Well, yeah, and it's been a real challenge to recruit speech and language pathologists and OTs and PTs to Birth to Three because of the rate. So you can see going from $120 an hour to $167 an hour is a big change for those at the highest level, but not everyone's going to be happy with that. But it's our attempt to say we really want to recruit and retain the professionals doing this work.
Yeah, and a Birth to Three program would be very difficult to have without those specialty areas. So yeah, totally understand that. Representative Johnson, I'm sorry.
This is Tony. Hi, I'm just asking a question. It doesn't have to do with the questions that are in line, but I just would like to get hi Beth. I would like a 1-pager from you guys on the trust fund for the funds, how they're going in and out. So what the structure is and everything, because I was waiting and I didn't see anything, and I don't know if you covered it in other meetings, so I apologize. But I really like a pretty condensed, not long, but clear on the.
Is this too big?
No, that's not too big. That's not too big. That just, but as long as it outlines the information of it and how it's going to go.
Sure.
Okay, thank you, Madam.
Thank you, Rep. Walker. Rep. Johnson?
Thank you so much. And I just wondered, did you, I know that this program saves the local communities a lot of money because of the work that's done in Birth to Three. And I just wondered, is there any analysis that we have in terms of do we have a way of analyzing the cost savings that occur because we have this program and how, you know, how great it is. But I just wondered if we had any way to do that, because I think it's another way for us to fully understand how it impacts. If we don't have these programs or if people don't participate, that it really will cost the special education groups a lot more.
I'm going to turn to Dr. Cosette, who's just finished her doctorate, to speak to that, and if there's a study or something we can send to Approps.
For Connecticut, there's not anything that is directly related to our current system. We have worked in passing with CSTE and really thinking about these questions and what that cost savings is. From a national perspective, there are studies that support the savings in early intervention, and I'm happy to pull that literature down and share it with you all.
Thank you so
Really
much.
appreciate that. Thank you. Sorry, Madam Chair.
No, thank you so much. And we've come to the time. You've really gone through all the questions, so we made it through. And if there are any other questions, we can certainly take those and communicate back. I would love to hear, like we said, a presentation around the study. I think that would be really interesting to do it, to follow up on. But thank you so
I can follow up with Senator McCrory too, one-on-one. I'll call your office, Senator, to answer your questions.
Perfect.
I'll reach out to you. Let's talk. We're
Sure.
having a conversation often. I
You
just
got it.
figure out how it's gonna play out. And I'm not.
Well, if you can tell me that, I'd be thrilled.
Okay, then we're on the same page. That'll be a good conversation. All right, thanks.
All right.
Thank you so
Thank
much.
you.
It's good to see
You
see
too.
you. Good to see all of you. Thank you so
Okay.
much.
Bye-bye.
Bye-bye.
Everybody.
What just happened?
Plucker and her team are in.
I don't see, I have disappeared off the screen here.
Can you hear me?
I can hear you. I can't see anything. I'm going to just go out and come back in. This is odd. Oh, there we are. I don't know what happened. Good afternoon. Can you hear me?
Yes, we can hear
Okay,
you.
great. I don't know what just happened, but I think I left with the OEC and I came back. I don't know. Oh my goodness. So good afternoon. This hour will be with SDE. And so is everyone on? Is everyone in, Madam Administrator?
Yes, ma'am. The commission
Okay.
team are here.
Okay, great. So let's get started. Good afternoon. I just wanted to, if everyone could do if you could do a brief introduction so we can see who all is here, and then we'll be ready to get started with our questions. Hi, Commissioner. I can see you now. How are you?
I am very well, thank you. How are you?
I'm doing well, thank you. Thank you for asking.
Good. Did you want my team to do a brief introduction? Is that what you were asking? us to
Either
do?
they can or you can, whichever you'd like.
Okay, perfect. And we will do this quickly, and I'm going to go by my screen. So, Deputy Commissioner Hughes.
Good afternoon, Charles Hughes, Deputy Commissioner for Academics and Innovation.
All right, John Frasinelli.
Good afternoon, Division Director at SDE in School Health, Child Nutrition, and Family Services.
Perfect. And Jessica?
Hi, Jessica Brunetti, Chief of Fiscal Administrative Services for SDE.
All right. And as we're doing this, you can get the sense of the kinds of things that they should be contributing to as in our conversations. Representative Robin?
Good afternoon, Robin Cecier, Director of School Choice. A little bit sick.
Thanks, Robin. My team I'm going to go to Laura.
Hi, Laura Stefan, Chief of Staff and Legislative Liaison.
All right, awesome. Roger?
Good afternoon, Roger Person, Chief of Fiscal Admin Services.
All right, Irene?
Good afternoon, Irene Parisi, Chief Academic Officer, includes academics, CTE, and adult education.
Awesome. Ajit?
Ajit Gopalakrishnan, Chief Performance Officer.
All right, and Brian?
Good afternoon, Brian Klimkowitz, Special Education Division Director.
And I think one more, Charlie Kenyon.
Charlie Kenyon, Special Assistant to the Commissioner.
All right, I think that's my team, Representative Exum.
Thank you so much. Thank you all for being here this afternoon. I know we have a whole lot of questions. So what we've been doing is kind of just going through them and allowing members to ask questions along the way. So I'll turn it over to you, Commissioner. I know we started off with special education oversight and funding.
No, absolutely. And you have a document, questions that were asked during our appropriation hearing. There was a question about the $40 million, and I know folks may have question on that. We are still doing some assessment of the final payments that have come in on excess costs. So we don't have a calculation for you right now because we want to make sure it's accurate, and we paid out the first batch of payment went out in February, but the final usually goes out in May. And so we're still doing that work right now around it. So as soon as we have that done, we will certainly do a run by town and share that with you all so you can have it.
Great.
The other information that were asked was about approved private special education programs, what we do for approvals, and also the town by town calculation for special education. And that is attachment C of your document as well. So prepared to answer any question that you may have. And let me just add as well, because we provided information on the application, the statements of assurances, and what we do here at the agency, but also want to bring your attention to the fact that the auditors of public accounts, also in legislation, perform audits for private special education programs. And there's a whole piece around that in terms of monitoring and oversight that happens through APA. And we gave you the legislation for that as well. So let me pause there, Representative, to see if there are particular questions back on special education. I know it's a hot topic this session.
Absolutely, it is. And one of the things I appreciated getting the information, I read through some of it, just looking at that attachment around the private and the therapeutic boarding schools. I didn't realize it was divided with SDE along with, DDS or DCF. So it's kind of a hybrid there as far as who covers kind of what. But it still is something I'm very curious about it as the way it functions, as the way those schools actually look and run, like who is really watching out for those students and looking at some of the qualifications of and what it requires to be a teacher or a therapist at those schools. It continues to be something that I'd like eyes on, personally. But I did appreciate getting to see the document and the contract help me understand it more. Are there any questions regarding special education oversight and funding from anyone? Rep Corpus?
Thank you. Thanks for being here with us again, Commissioner. The emergency appropriation we did as a legislature for $40 million for special ed. There was the first one on February 24th. There was a second, there was a veto, and then there was a second one that came back on March 5th. I believe, and I'm just seeking clarification, in the March 5th bill that passed and was signed into law, does that bill allocating a $40 million appropriation right now in an off-budget account preclude any more money being allocated to special ed this year? How does that whole thing work?
That, Representative, I'm not certain about how that works. I understand this to be the one-time funding that was done. And so I see Representative Walker not here. So that's our understanding, is that now we're working with that 40 that was done. So any other potential funding, I think, would be left up to the legislature around this. As you know, in the governor's budget, there's a $40 million for 27.
Okay, so if the revenues, so if the current spend rate in the 25 budget exceeds that 40, it would require like another emergency cert, or is that not possible given the language in the governor's second bill?
And that is something I'd have to check on from the legal perspective, Representative, to see if there's any restrictions based on the current language that's there. That I can have an inquiry with our legal folks to see if they can answer that question for us. Okay, thank you.
Thank you. Rep. Walker?
Thank you, sorry. Good afternoon, Commissioner. One of the things that I've been looking at and asking about is capping special ed costs and how we're going to handle that. Are you guys, I understand you were doing a study or you're doing some research on capping the costs now, is that correct?
So for the not capping the cost so much as it's setting rates.
Yes,
setting rates, and we are actually doing a study right now, and that's setting rates for providers of special education programs, not limited to approved privates, is the study that we're doing. And I think we're just about there with talking to our neighbors who've done this to support us in making the best decision for Connecticut. I know Ajit Gopalakrishnan is leading the work on that for us. Ajit, I don't know if there's anything else you'd like to add to that piece, but we look forward, Representative, as that really is an important aspect of the work that we're doing. And we know it's not alone. We're doing that work along with looking at high quality programs. I know that is also in the governor's budget, where districts or regional districts can come together and build programs as well. So it's not only about the rates, but it's also about trying to get kids into their districts instead of going out as well. So I just want to put that in that space as well.
Well, the other part of that is you said that the accountants, the auditors are responsible for auditors of public accountants. They're responsible for actually determining the impact of those private and public special ed programs. Do they publish something on a regular basis about the facilities, or do they not? Do they go and evaluate them every year, every other year? What's the time frame on that? And do we get a chance to read some of the evaluations of those programs?
So we sent the legislation representatives. So Section 1091G lays out specifically what's required. And so they do audits of these special education, approved private special education programs. We also do monitoring and oversight. So it happens in both places, but it's very specific in terms of what they do. They use a risk-based approach outlined in legislation. And at the end, that their reports go to the General Assembly. And so you get a chance to see those reports when they're completed. They do make recommendations as a part of that as well. And I know they're in the process of wrapping up some right now that I'm sure that you will be seeing at some point in the near future.
Okay. Thank you, Madam Chair.
Thank you. Rep. Johnson?
Thank you, Madam Chair, and thank you so much, Commissioner, for all your work. Just a question, two questions. So when we looked at the amounts before we had the bill that just passed to allocate additional funds, the $40 million bill that we passed for this fiscal year, we had some communities that were, say, not as distressed as others, yet they received a higher percentage in terms of the excess cost reimbursement than did the less distressed communities. And I wondered how that could have occurred.
Representative, all of this is laid out in legislation as to how the calculation occurs. Based on town wealth and all of that, and we can share that information with you.
I understand that. I don't mean to interrupt, but the town wealth, when the town is already deemed to be the poorest town in the state, and they get a smaller reimbursement percentage on the excess cost than a town that's in the middle of the road in terms of the value in how would that happen? I just don't understand that.
So I'm looking at my members of my team that may want to chime in about the process is this about how the town wealth
Yes, town wealth, town population, the in the numbers of students that are special needs, all those kinds of things would have put the town at a higher rate of reimbursement. Yet they got less in terms of the overall reimbursement rate than towns that had a much better rating in terms of wealth, student population, less students on special ed, all of those things. And to get that kind of reimbursement, I was kind of shocked. So it's okay if you want to answer later, that's fine. I don't want to take up the time. But the other one is we did go to the year before last, we had our excess cost based on the ECS formula. And then we went back to not doing it based on the ECS formula. And this might actually connect to the first question. So if you could give us a little bit of information as to whether or not this is something you're continuing to study so that we can maybe put ourselves in a better light on how we take care of the towns that have the highest needs and the biggest numbers of students with these needs.
So Ajit, I know
Representative Johnson, good afternoon. It would help for us to know which two districts where you felt like there was disparity. That would allow us to sort of look to see what might be going on. So if you could share that with us, that would help.
Sure.
We can definitely look into that.
Yeah.
And to my knowledge, the excess cost allocations are not related to ECS. Like there is a separate formula for calculating excess costs, which includes the tiers, but it doesn't really connect with ECS, except that obviously they're both driven to some extent by town wealth, but they're really not connected in terms of formulas and calculations. They're different calculations altogether.
My understanding was that a couple of years ago we did it according to a general ECS, and then we stopped doing it in this last cycle. That's my understanding. I could be wrong, but
the piece that was done in 2023 was the institution of the tiers in legislation. But as we have explained previously, even after putting the tiers in, the appropriation was not sufficient to fully fund. So by law, as stated in law, we have to proportionally reduce even after the tiers. So yeah, if you let us know the district's representative, we'd be happy to look into
if I
it.
could contact you afterwards, because I don't want to put any particular town on the spot.
Sure, you can let Laura know and she'll communicate to us.
Excellent. Thank you so much.
Thank you so much. Representative Khan?
Hello.
Hello.
Hi. Good afternoon. I was looking at the time. Good afternoon, Commissioner.
Good afternoon.
So I just wanted to get some clarity. I know we started talking about a little bit about the audits that are done. So, and I was trying to understand some of this when we had the presentation, Special Education Committee. But just for some clarification, so the auditors that we have that audit our private programs, do we know roughly how many they do a year? And what exactly it is that they are looking at? Are they looking at the program itself, like or are they looking at the budgeting, or are they looking at, like what parts of, or are they looking at all of it? So I'm trying to understand like what they're looking for and how often it's done, or how many they get a year.
Right. So in the legislation, and I know you all are very busy, but if you get a chance to take a look at that, because it's very specific that they use a risk-based approach to determine the frequency as deemed necessary. But no one would be examined more than once during a 5-year period. And it shares what they're taking a look at. They can also make a determination and prioritize based on those that receive the greatest total amount of state or local funds, those with the highest numbers of students for whom services are planned, highest proportion of state and local funds received from the Board of Education. So that is all prescribed in 1091G of our general statutes. So that is how that's determined, and also at the end that they share the report with us. I don't have represented the actual numbers, that they've done over time. Brian, I don't know if you do. We can certainly get that, or the APA can certainly share that information but that is very prescribed in legislation as to what they do for this specific audit.
Thank you, Commissioner. Yeah, it's roughly between 6 to 8 schools, give or take, throughout the years.
Okay. And so we talked about this a little in committee. Brian, I know you were there. So 6 to 8 a year. We have 88 approved programs. So just my concern, and I just want to flag it here, especially because this is appropriations. What would it specifically take? Would it just be more auditors, or what would it specifically take to have programs audited, more programs audited in a year? So just roughly, and I did the math for you in committee, but 6 to 8 per year with 88 programs could mean it could be 11 years before a program was to be audited again.
So Representative, one of the things I asked Laura, and I know she was ill, so I don't know if she had a chance to reach out, because I really wanted to come to the committee to really focus on our monitoring, our general education monitoring that would include information on what APA does. So you can get a sense of our general supervision around special education and what that means, what we're required to do federally, what it is that we are required to do in our state statutes, and then how we effectuate that. And so you can see together not only what APA is doing as an audit, but the monitoring that the agency is doing as well. I think it's important to have that complete picture. So I asked Laura to reach out to you, offering to come to one of your committee meetings so we can focus specifically and comprehensively on monitoring and oversight. I think that is really important, that the big picture can be had, and I think that will allow you to better understand the numbers, what we do, what APA does, and how we do all that. I think I would look forward to having that conversation with the select committee.
Okay. Yeah, I saw Laura's email this morning. So right before actually this meeting specifically. And we can have that conversation there. That's absolutely okay. There's one other document here on, I think it's like on the top, it's just titled Year Annual Statement of Assurances. Just by looking at it, I assume this is something that the programs just submit. And there might have been a description of it in the other thing, but is it something they submit annually?
Yes, it is.
Okay.
Yeah.
So I have a question around this as well. What happens if there is something internal that occurs? Is there a mechanism by which someone can report a particular issue that would rise to having a more intense scrutiny on a particular program, kind of like a whistleblower, someone who either is a parent or someone in the school? What is there a mechanism for that?
Absolutely. And those come to our attention, Representative, in many ways. And those also trigger monitoring and visits that occur. And that's why I'm saying to Representative Khan that it's really helpful to get a big picture, comprehensive picture of the standard planned visits and oversight that happens, and those that happen by way of, sometimes it's an OCA investigation, or those that come to our attention outside of that process. Also know that we have a call center that we've now put in place. I think it's a little bit over a year, and a phone number that families and anyone can call to ask questions. And so it's many ways that can trigger or additional oversight and intervention. And so I'd be really happy to share all of that with the committee.
Thank you. I'm so sorry. I don't know where I disappeared, but I can't see anyone. Oh, there you are. Okay. I'm sorry. Senator McCrory. Something just glitched on my end. Senator McCrory.
Yeah, I don't have a lot of questions about special education. This is an issue that's been issued for a very long time. I don't have a lot of questions. My question is, and this is for Rep. Khan, I'm sure she don't have to weigh in, but Commissioner, the number of students who are identified with special needs is well over what typically has happened over the last 5-10 years in education. Is there any reason why we're seeing so many students labeled special needs more recently in the last 10 years? That's my first question, because I'm just saying, if it's so special, why so many students are in special ed? I just don't understand. What's trending? What's causing this trend? That's my question.
And that's a great question, Representative, and Brian, you can unmute and get ready to do that. It's something that we're certainly looking at. We're at the numbers, and the prevalence rate is increasing. And I think as we're talking about all the things we're doing on the end of what do we do for supports, and families we're looking for this specialized support for their students, which is really important. But we need to always continue to take a look at root causes. Brian, I know we've had this conversation and want to share some thoughts.
Absolutely, and it is absolutely a great question. And there's many answers that are contributing to the increased prevalence rates. One thing to note is it's a national trend, not just here in the state. So other states are experiencing similar increases in prevalence rates. The first thing I'll point to is that I believe our special education teams are better adept at identifying needs of students than they have been in the past. If you look at our numbers, the students with autism has exponentially increased. We've had 100%, over 100% increase in students with autism over the last 15 or so years, Senator, as you mentioned. And so we also know that students who experience trauma, which we know as a state we experienced shortly ago, their presentation in school is similar to students with disabilities in the fact that those trauma experiences and students' social, emotional, and mental health needs contribute to needing interventions. And oftentimes those special education teams are involved in that process. We also know that that identifying students early on is so critical and important. And general education interventions are essential in ensuring that students' needs are met even prior to an evaluation. And given the budget issues that our local districts are facing, oftentimes those general education interventions are intermittently assigned, or in some cases districts have had to make difficult decisions, and the general education interventionists have been let go over time. So it's a multi factors that have contributed to the increased prevalence rates, but we've been focused on also ensuring that students are receiving the right interventions at the right times, so that they can be exited. That in many cases, special education shouldn't be a life sentence for students, that the intervention should be provided early and often, and then that student may only need accommodations. So
let me ask you a quick question, and
Sure.
I hear your explanation, and I don't know if I asked the right question, because I'm trying to figure out trends. What's causing this? What's causing these young people to be in a special education? I'm not hearing this is happening. Children been traumatized forever in the state of Connecticut when they go to school, in our country. I don't know. I guess the second part, I guess I will be asking is, when we look at these programs, do we look at how many of our students that are coming out of special education? Is there a number? Do you see? Because what I've learned and realizing, it's easy to get in, but it's very difficult to get out. And do we have any data that shows X number of students exit special educational services at some point, or is there a trend that says many students after sixth grade, they see the number decreasing? Is there any data on that? Because when you talk about supports in place, right, then that means we got to know where to put the supports. Do we put the supports very early when they're in kindergarten? Do we put supports in place in fourth grade, sixth grade? And what kind of supports we put in? Is a kid being placed in special education because he or she has not learned how to read yet by third grade? So when you say putting supports in place, all these things are very important to know where we put our resources. So I guess that's, if you want, you don't have to tap. I mean, you can say, give me your best answer. I didn't want to really bug you down on this particular question, but give me your best answer.
Commissioner, would you like me to respond?
Yes, no, I was gonna, yeah, I'm gonna have to talk about those exiting.
Absolutely. You actually absolutely hit on that point. We do have data as far as, students who have been exited. There's 3 reasons for a student to be exited. One is that they reached maximum age of eligibility. And to your point, those are students who, have significant cognitive impairments. They're receiving services all the way through the end of the school year. Another exit could be to return to general education. That's to your point, that those students have received the interventions and the team determined that they no longer require specially designed instruction. That doesn't mean they may not need accommodations, but at that point in time, special education is no longer appropriate for that student. So that's really what we need to key in on. Every 3 years, the IEP teams come together to make a continuing eligibility determination. So we've been on those in ensure that the teams are making, those important decisions and critical decisions to be able to exit. And so,
Brian, do we have that data that we can share? Would that be helpful, Senator?
I think that would be helpful to share that data would be really good.
Exeter data.
Yes, please. I think that'd be really helpful. If we could just kind of move along to the next area, the IDEA funding. I recognize we have a lot of questions and only 30 minutes left, so I'm trying to kind of get us through. But the IDEA funding, Commissioner, if you could lead us.
Right, so you had asked about the funding and how it is determined, what the amount is that's kept at the agency, the amount that passed through to district. So we gave you, this is all in federal law. There are 2 pots of resources, that the one for 611 and 619, different age groups of students. And so we shared with you basically how it's determined and allocated. It's all in the federal IDEA law. And the way we can spend those resources and how we've actually spent the resources, or at least designated it for its distribution, is in those charts in the document that we gave you. And then we also gave you the breakdown by each district, so you see what they've received. So that's the whole other section of what we provided to you here. Bottom line is, we don't design how it's distributed. It's all federal formula calculation. It's what we've done on that, and that's what we've shared with you. So I don't know if there's specific questions. And as I said, you have it. So if you want to know by your district what they've received, that you do have attachment C that provided that information for you. So I don't know if there's any additional questions there.
Are there any questions? Okay. We can always circle back, but let's continue to move on.
So moving through, there were questions on ARPA funds, and we shared with you pretty much everything that we have here at the agency. They're in different, certainly, places for anything that's funded with ARPA fund. Those funds, those can go through December 31st of 2026. So you see those. The others that we have are for ESSER, and they also have liquidation that's requested, that's approved by the federal government. But I don't know if there's a question. There's a specific one in the LEAP program as well. There was a question that we had on LEAP and where we are for funding. So we provided everything there for you in those in that attachment. And don't know if you have any questions on that, but that's where we are with those funds.
Any questions around these funds? I don't see any from the members.
The other section, representative, is on the student services supports, that one single grant. So we gave you information on everything that's included in there just for your own knowledge as you are making decisions around that, but you had asked us to share that with you, so we did. So we provided information on after school or FRCs. It's all in those attachments for your information, attachments E through J.
And I just have to say, when one of the areas coming up when you mentioned the FRCs, we're just hearing a lot about not combining and getting rid of, changing that funding because of the, vital nature of what they offer to so many families. So that's been a part of what we've heard quite a bit about, of the combination of those funds, the commingling of that into one grant has received a lot of pushback and not favorable. And there's a little bit of money that seems to go a long way. I mean, you talk about something that does something to really enhance and make a difference. The Parent Leadership Training Institute, all those different kinds of programming. So I just want to bring that up. I want to know if the members have any questions around any of these grants. And if not, for charter schools, Rep Walker, I want to call on you for a minute.
Can I ask a question not on that? Can I ask a question?
Absolutely.
Commissioner, I want to talk about alliance districts. Alliance district and alliance funding. I've heard many versions of it, and I think I'd like to get the facts out, to make sure that everybody understands exactly what the purpose of alliance districts were. I remember when they were developed, because we were having problems with certain areas in some school districts and trying to get some of the school districts to respond in those areas, like math, English, behavior. I mean, there's a whole group of them listed in the statute. And so what an alliance grant is it's taking a portion of your ECS dollars and setting it aside for you to comply for that area that you have to have growth in. It is not taking the money away. It is providing you with, say, this money can be targeted specifically for that need that you feel is important. And many times the reason why that happens is because, as everybody knows, I'm sure, ECS dollars are really municipal dollars. So the cities get the money and they divvy it out to the boards of ed. And sometimes the ability for them to get the money for the specific things that they feel, the school feels they need, doesn't always come through the mayor and the governing body. So the purpose of it was to make sure that boards of ed had funding that was going to be targeted in those areas. Am I correct on that?
You're absolutely correct, Representative. It's setting aside a portion of those funds directly to the Board of Education in exchange for working with them to address areas of concern. There are lower performing school districts, and there's a lot of oversight and work with them to make progress in those areas that are identified. So you're absolutely correct. It's not taking away the money, but it is truly carving up. So it's not more money, it's not less money, but it truly is identifying some of those funds that will be used for specific interventions and work with the districts for the changes that we are indeed looking for.
Yeah, because I've heard sort of a misrepresentation that this money is never given to the districts. The money goes to the district. That is the end goal. The end goal is, and then they are evaluated on what they've done, so that if they have to, they may have to repeat that whole process again the next year. But the point is, it's training and it's money that they have to utilize. Because I had a mayor say to me that we want to get rid of Alliance dollars, because Alliance grants, because we're not getting the money. And I said, well, how is it that you're not getting the money? And they said, well, we're never getting. I said, well, no. So then what I had to do was pull the dollars out in the charts and show them how much they started with, what they got, and what they got with the Alliance dollars, and what the end result was. And each time I've done that, it's like, well, that's not exactly what that is exactly what happens. And I don't want us to feel like we're taking it away. What we're doing is we're helping our districts improve the quality that they need to improve in, and giving them the support. but also making sure that they have access to the funding, because we also know that some of the city halls and boards don't necessarily understand education. And they may not understand the impact and the importance of it. So it takes it out of the city's discretion and puts it back into the Board of Ed, which I think is really, really critical. Now, I know you've helped us in New Haven. I've also seen you in Bridgeport. I've seen you in so I was talking to someone and they said, well, SDE cannot do that type of hand-holding anymore. Is that true?
We continue, Representative, and thank you so much. May I just add one thing as I'm answering that question as well, because I think it's important here, jumping a little bit ahead of testifying tomorrow on an Alliance District bill. But the other thing that the legislature did was to charge the department to do a report and make some recommendations on reforming that program, starting in 2012, the Alliance District program. That report is due in January, and we're well underway, I think, with what's going to be some really good recommendations, because as you may know, we have tried over the past few years to keep the numbers at 30. And when we were trying to, when folks did better and improved so that they could exit Alliance, they didn't want to, because they want to still have access to this resource that's coming directly to them for the work that they are indeed doing. And so we would like to look at the reform, so we're not constantly, for the work that we're trying to do, we totally agree that at some point we should take a look at how we've designed the program, so we're not constantly adding, because to your point, the work that we're trying to do gets diffused and get more and more complex for us to add. When we start with 30, we're now up to 36 for the level of interventions and support that we want to provide. So we want to do that to make sure. So the fact of having fewer is not a bad idea. My recommendation is, let's wait for this report that the legislature charged us to do, that is going to be very thoughtful with some excellent recommendations, and then we go ahead and we do that. As you know, our agency is not large, and we want to make sure that we do this well, so we get the impact of what it is that we're trying to get done. So at some point, I think we need to take a look at it so that we can continue to reform it, see what outcomes we've received. We can share with you that what have we seen for outcomes and what recommendations we have for getting it to a number that actually, I think, works best for us to be able to get the outcomes we're looking for.
Also, I heard somebody say, and is this true or not? There are districts that have gotten off of the Alliance list, and sometimes they come back, but there's some that never come back. Is that true?
So, right, we had districts that made progress enough to be exited. And when we tried to do that, legislation prevented us from doing that. So we've done that. So no one's actually exited. We started at 30. And when we were trying to exit folks because of their outcomes, your legislation did not permit us to do that. So the numbers keep growing. It's almost like you come in and you never go out. Yeah. But not because they didn't make progress, but because the legislation changed to keep them in. I'm looking at my team to make sure that is accurate. Ajit?
It happened twice, Commissioner. That happened twice.
Okay.
Once in 2017 and then again in 2022, when in each instance, there were 3 districts that could have exited. But legislation was added to basically say that any district that was previously an Alliance district would remain an Alliance district. So essentially, we just kept adding.
Well, the other part of that was that I think we all need to look at the funding that goes into our school districts. And we need to look at what the ECS formula funding is for the district and how much our local town provides, because it's a 3-pronged funding. It's local, it's state, and it's federal. And the reason why I say that is because if we look at it honestly, many of our local towns do not increase the amount of money that they put into our schools. So therefore, that's just giving us a flag that says, no offense, CCM, don't call me and attack me, but we want the education money to go to the education, not to City Hall. City Hall has their access and their ability to get money from a lot of places. our boards of ed are being squeezed out because of other things. I wanted to go to education and education alone. So thank you, thank you, thank you, thank you, Ajit, and thank you, Commissioner, because I heard a debate one day and I wanted to go and get into it, but it's I didn't have enough time. So I just wanted to make sure that we talk about it very clearly. So thank you.
And Representative, thank you for that. I also want, for the benefit of everyone here, we've on our EdSite data portal, we just added a new data report, and it is expenditures. And for every one of your districts, that you can go on there and see for the past 5 years how much money was expended that were state funded, how much of that was local, and how much was federal. And it tells a story by taking a look at that. So I encourage folks to really go on EdSite. And Laura, we can probably send it to this group, the link. Find your district. It gives you a 5-year history, how much federal money were expended, how much local, and how much state. And in one place you can find it. And as I said, it would be great to take a look at that to then have conversations around overall funding. But we've done the work for you to make it easy to get that information.
Yes, we appreciate that link. If we could get that, that would be wonderful.
Thank you. Thank you. Thank you, Madam Chair.
Thank you so much. And also, looking back at the, I want to circle back to the list that we had here of questions around behavioral health services, the primary mental health. And I know you have a nice chart there, but you did a wonderful report to look at how we were using the money through ARPA and the mental health workers. And as you know, this is something that's near and dear to me, this particular area of focus, because as we're looking at, you're asking about there's a link between special education and behavioral health as well. And I just wanted to know if you could kind of do a high level around the mental health piece, behavioral health services, and what you're saying, and then kind of what you're thinking as ARPA wraps up and where we go. And I also appreciate the vignettes that you gave too with some of the highlights.
No, perfect. And John, I'll get you on deck as well, but I so appreciate when we talk about, we have to think about those non-academic barriers to learning, and we must consider about students' mental health, their nutritional health, their physical health, their behavioral health when we're talking about improving outcomes, right, and improving learning. And so, John, thank you for your team. I know that we summarized this, and for those of you that didn't get a chance to take a look at it, John, just briefly, what those reports that they have in attachments E through J, what it is, and kind of what we're thinking about for moving forward.
Thank you, Commissioner, and thank you, Representative, for the question. Yes, we had a conversation earlier in this meeting about special education, and Brian Kumquist will say that we're especially hearing from our special education and pupil services directors in the districts how great these positions have been in terms of easing the caseload and addressing the needs of those students, as Senator McCrory indicated, that those numbers keep going up and that these positions are super helpful. The first round of funding, the $5 million sunsets on June 30th. Those are 20 positions, mostly social worker positions. The remaining 75 positions or 73 positions in schools go until the end of the 26th school year. In addition, we have 83 recipients of the summer mental health grant programs. I will say that we've had some challenges getting folks to apply for the summer mental health. The first year we got 45 applications. We put it out again in the second year. We got 36 applications, and we're just announced an hour ago. We've got about $650,000 that we're putting back out to ask those recipients if they could use some additional funds to support this final summer. And so the work is continuing. We're taking what we're learning. You can see the testimonials from all of the districts that provided exactly what those programs are supporting. We're taking that, we're combining that with what we're learning in our behavioral health pilot in 7 additional districts, and hoping to share best practices around all kinds of districts for them to be able to use what funding they have, and likely to be Title I funding or Title IV funding from some of the federal funding to continue to support the social emotional behavioral health of those students.
Very good. And while it's difficult to perhaps get providers or enough people to do it over the summer, what is the response from the students and the children? Like, do you have enough people who are in need of the services, who want the supports, who want to participate? And you just don't have enough providers? I'm just curious how.
You're muted, John.
Oh, you're muted.
The summer funding is really interesting because what we were able to do was to provide additional funding for programs that were already existing, some really innovative programs, for them to add some mental health supports. In other words, like we've got a summer drama program at the Bushnell, who they were like, hey, we could use some money. Some of our kids are struggling, even though we're teaching them drama. They've onboarded someone to be able to provide some mental health counseling for those students. So we're taking where students are already gathering over the summer and sliding in some of that mental health and bridged into the next school year.
Got it. Okay, that makes total sense. Just as you would at school, you would have those supports there where the students where they already are. Okay.
And districts, represent, they appreciate this, as you talk about our students as well, appreciating that level of support. And so, the other thing that we try to do with districts as well is we talk about blending and braiding funds to think about, are there existing federal resources that they have that could help to support some of this. But it is so critical and so important for our students' well-being. And I never forget our educators as well, that we need to also be thinking about their own well-being as they're supporting students.
Absolutely. Absolutely. That's a really good point. You're right. And I do think that, it's so good to see it. I did know that when we proposed this, we were using money that was not going to stay, but I thought that the usage is really important, and you're seeing, I'm sure, the benefits of this. We have a huge, the behavioral health crisis persists. And as you said, a child can't really learn if they're dealing with a mental health or behavioral health issue. And so it's good to see the utilization, but, and I hope we can come up with continued creative ways to provide those services and supports. Representative Khan?
Hi, just on that, same piece on the, and I'm looking at the one that's not for the summer grant program, but same mental health, specialist for, I guess it was 23 to 24, but, specific question on like, I assume, or I had always assumed that we have some sort of a, maximum amount that a social worker can have on their caseload. Does the state have a mandated like maximum, or do we not have a mandated maximum? Only because I'm seeing like huge discrepancy just across districts. So I was just wondering if there is.
You can go ahead, John.
Thanks, Commissioner. Thanks, Representative, for the questions. Great question. There's often a lot of talk about ratios of clinicians to students, but what we find is that with these grants, and in particular, even the positions that districts are hiring, we leave it really up to the districts to identify the specific disciplines that they need based on the students' needs, right? So as Brian mentioned around special education, we've seen an increase in the number of students identified as autism. So we need to make sure that districts have the capacity and the autonomy to decide to hire board certified behavior analysts to serve the needs of their population because they have a higher population of autistic students, right? Same way we know that high schools need to have more school counselors on staff to get students ready for college and career, so that they may have they may have higher ratios of social workers in high schools, but they have lower ratios of school counselors for that specific position, for that specific reason.
So we allow that kind of that flexibility versus just trying to connect to a ratio is what we always work with our districts on. But thanks to, we have a dashboard also on that, so you can see where we've landed around the ratios by school district. So we can see that as well for full transparency.
And you'll see in the legislative report that we produced last year, you'll see the ratio based on this funding, these ARPA mental health funding that we were just talking about. You'll see that the ratios were decreased in each category of clinician based on the investment in these funds and these positions, obviously.
And then, I don't know if this was mentioned earlier, but how did districts apply for these? Was this competitive and certain districts got it, or everybody that applied for it, or had to meet some criteria?
It was competitive, and not every district did get the award, but it was all competitive. With the summer mental health grant programs, everybody that applied got funding.
So we had more applicants than funding, I think, on the other ones, I believe.
Yeah, yep, for the school ones, yep.
Oh, so all done, all set?
Yes, yes, I'm good.
Thank you. Senator McCrory?
Yeah, I'm sorry, I missed it. You said there was a grant opportunity for summer mental health programs that you guys are doing. That's Commissioner, I caught the end of it. I was preoccupied with something else. Where,
Yes,
what,
there are.
what budgetary line item will those grant opportunities fell from or will fall in?
This is the balance of the American Rescue Plan Act fundings that were obligated in December. There's a balance of about 650,000. That's going back out to those who already have some money for summer mental health, and they're going to be able to apply for an additional $10,000.
Okay, so you have, as of December, you had $600-something that you still had not allocated, and that's going to go back out to those programs that received the grant initially. Is that correct?
Exactly.
Okay, thank you.
Yep.
Thank you so much. I just want to be sensitive to the time. So I wanted to move us along to the ECS grant increases to see if there were any, if you could give us any comments on that and if there are any questions around that. I'm just trying to be sensitive to time.
No, we were asked a question about the expected uses of the funding. This is specifically from the legislation, the language that we have here, that for increases, that how it would be utilized. And the question was, what would be the impact? How many districts would be impacted? So we provided that for you. So this is in HB 6866, Section 6, that is there. And so we just share that with you, just so you will have that information as you requested. This is directing increases to be used for chronic absenteeism, for student disengagement, academic recovery, very specific for additional funds to be dedicated to that.
Any questions on that piece? Charter schools. Let's move to that. And the question was, what would be the cost be to implement the 7 recently approved charter schools?
And you have, so that's attachment N, and it's a Nancy in your packet. And so what we did for you there was to give you an estimated, based on estimated enrollment, what it would be for 26, what it would be for 27. So a little bit over, close to 10.5 million in 26, another 18.9, so 19 million in 27. So we provided that calculation for you to have available for your decision discussions.
Thank you for that. Any questions around that?
Yeah, I have a question.
Okay.
Commissioner, I thought a couple of years ago we passed legislation where we are pretty much allowed the state board to approve up to 2 charter schools every year, every 2 years. It didn't pass legislation around that before. I'm questioning.
I'm looking at Laura to help jog my memory on that. Maybe it was proposed, but maybe not passed, is what I'm thinking. Laura?
Yep, that's exactly right, Commissioner. So Senator, under current statute, we're required to do an RFP every year. We have a budget proposal that would actually seek to do it every 2 years to align it with the governor's budget. And there is no limitation on the number of charter schools that we can approve.
Okay. So my question would be, we have, I think you said 6 or 7 lined up, 7 lined up. There's no way, I know, you know, and everybody else who's listening, no way we're going to open up 7 charter schools in 1 year. It's just not going to happen. But you know, and I know that every year or every 2 years, we do open up schools. It's going to happen. The idea I have around this is we know we're going to open up X number of schools every year. My attitude, my position is, and I want to know where you guys, shouldn't we have money in the budget to open up X number of schools if we know they're already lined up and ready to go? What's your position on having money in the budget? Like you said, you have a piece of legislation that you can propose us and make sure we have these dollars lined up with the governor's budget. I'm assuming you're jumping. All I'm asking is, it doesn't make sense to get out there and start doing that right now, because this is the budgetary year, to make sure we have money in the budget if you're going to open up a couple of schools.
So lots of conversations about the budget, and as you know, and I certainly always defer to our OPM and certainly the governor's office around all of this. And of course, I know that's where the budget discussions begin. But I think that's a part of the discussion, Senator, and that's why we had thought about the proposal, to try to line up with the actually biennium, to have schools kind of in that pipeline. Of course, we have a challenge right now because there's 7 schools that's lined up right now for funding. And I think those are conversations that we need to continue to have around it. I've done our due diligence on our end based on legislation, and we're trying to adjust that. Because frankly, the conversation is, if we have X number of schools in the pipeline, do we continue to go out and add to that list, before we know exactly where we're headed there? And I think we should continue to certainly have that conversation about the process moving forward.
Thank you.
Thank you so much. I'd like to know if there are any other questions. As I'm looking at the time, we're right at time at 2 o'clock. I really thank you all for coming forward today and for this information. And there is a lot of information to the members that was provided to us, which I read some of it. I couldn't read all of it in time, but there's plenty of it there. And we know how to reach you if we have additional questions. But thank you so much for coming. If there are any last minute questions, we can take those. But otherwise,
I have a whole lot of questions, but I'm make sure everybody can get out of here. It's a good time, so I'll just save them for when I have a conversation with you.
That's perfect. That's perfect. Thank you, Senator.
Thank you.
Thank you so much, Commissioner and team.
Thank you all.
You all have a great afternoon. Thank you so much.
Thank you. Yeah.
Bye-bye.